Welcome to the Nurse Navigator Network. Today we're going to review NCLEX questions and answers with rationales on airborne, droplet, and contact precautions. Stick around until the end for a recap of key points and a reminder to help you keep these precautions straight for exam day. Let's begin. Question 1. A nurse is caring for a patient diagnosed with tuberculosis. Which infection control precaution is required? A. Standard precautions only. B. Contact precautions with gloves and gown. C. Airborne precautions with an N95 respirator. D. Droplet precautions with a surgical mask. Answer C. Airborne precautions with an N95 respirator. Rationale: tuberculosis spreads via airborne particles that remain suspended in the air. The patient must be placed in a negative pressure room, and healthcare workers must use an N95 respirator. Question 2. A patient with influenza is admitted to the medical surgical unit. Which precaution is most appropriate? A. Airborne precautions with N95 respirator. B. Droplet precautions with surgical mask within 3 feet. C. Contact precautions with gloves only. D. No special precautions needed. Answer B. Droplet precautions with surgical mask within 3 feet. Rationale: influenza spreads through large respiratory droplets. A surgical mask should be worn when within close contact, and the patient should be placed in a private room if possible. Question 3. The nurse is assigned a patient with Clostridioides difficile infection. Which statement about precautions is correct? A. Wear gloves and gown when entering the room. B. A surgical mask is sufficient protection. C. Standard precautions are enough. D. Place the patient in a negative pressure room. Answer A. Wear gloves and gown when entering the room. Rationale: C. diff requires contact precautions because spores can survive on surfaces. Hand washing with soap and water, not alcohol-based sanitizer, is necessary to remove spores effectively. Question 4. Which of the following patients requires airborne precautions? A child with pertussis. B. A patient with measles. C. A patient with MRSA wound infection. D. A patient with streptococcal pharyngitis. Answer B. A patient with measles. Rationale: measles is an airborne illness requiring a negative pressure room and N95 respirator. Pertussis and strep throat require droplet precautions, while MRSA wound infections require contact precautions. Question 5. A nurse is caring for a patient with meningococcal meningitis. What is the priority infection control measure? A negative pressure room and N95 mask. B. Surgical mask when within close contact. C. Gloves and gown only. D. Standard precautions only. Answer B. Surgical mask when within close contact. Rationale: meningococcal meningitis is transmitted through respiratory droplets, requiring droplet precautions. Airborne precautions are not needed unless another airborne illness is suspected. Recap. Here's a quick way to remember. Airborne: my chicken has TB. This refers to the measles, chickenpox, herpes zoster shingles, tuberculosis. Use a negative pressure room and N95. Droplet: think respiratory flu, meningitis, pertussis, mumps. Use a surgical mask. Contact: think skin or surfaces, C. diff, MRSA-free scabies. Use gloves and gown, and wash hands with soap and water when spores are present. Thanks for reviewing these NCLEX practice questions with the Nurse Navigator Network. If this video helped you, hit the like button, subscribe to the channel, and leave a comment below with the topics you'd like us to cover next. Your input keeps these reviews focused on what you need most to pass the NCLEX. See you in the next video.